Worrying is common to us as human beings. It is one of the various emotions we experience. People worry about academics, relationship issues, personal issues. Some people also worry about the past, and some brood about the future. So let me talk about a very relatable term called anxiety. I am Dr. Shailaja Pokhriyal and I am a clinical psychologist practicing since 14 years. I am also associated with Max Hospital. When these thoughts in our mind become overwhelming and they start interfering with the personal, professional life, and even in some cases starts interfering with the relationship, that is when we term it as anxiety. As a consequence, people begin to have self-doubt, they become restless and often have spiraling negative thoughts, which eventually in some cases disturbs their sleep and appetite. So anxiety is very common and prevalent among all age groups. Specifically, it impacts mostly in adolescence and late old age. It affects a large part of population, both females and males. Some of the various kind of anxiety spectrum disorders are obsessive compulsive disorders, panic attacks, phobias, social anxiety, and post-traumatic stress disorder. So is anxiety disorder treatable? Yes, it is. It's very important to understand the core of the issues, which is many times it is found that people experience angst when the thoughts are in dissonance, when there's a lot of discrepancy between what are the needs and wants of a person and what individuals actually get in life. That is when the person gets stuck into these loops. These loops generally keep spiraling and creating more and more angst. In such situations, one would want to visit a clinical psychologist or a therapist who would help you to identify the triggers as well as specific solutions. There are scientific strategies which have been established to help cater to such problems. Individuals are taught several ways and strategies to calm one's mind, tackle with disturbing thoughts, and also walk you through a series of actions and checkpoints which will lead towards normalcy. Another mode of treatment is pharmacotherapy. It is a combination of medications and psychotherapy. Patients with severe anxiety issues are usually helped with such kind of treatments. So how do we prevent ourselves from falling into this loop? Some of the options could be doing regular exercise, cherishing small moments of life, not taking life too seriously, smiling often, and also greeting others. Children and young adults must spend much of their time in outdoor sports and activities. Also, they must spend limited time on screen. As adults, they could act as role models. They could probably spend more time with their kids at home, maybe doing activities, some kind of fun activities. Adults as role models should try and spend some time with their kids, such as playing some fun activities, and also have separate time for their own leisure. Life is supposed to be cherished and not live in dichotomy. We must learn to overcome our anxieties and to do things that give us joy. Everyone deserves a better life. So let's live life fulfillingly. I hope the information shared on anxiety-related issues was helpful. Do ask your questions and express your thoughts by commenting and subscribing below.